It's always wonderful visiting my peeps. Yes, I'm at Ponte Vedra Vein Institute. We've got Megan Deacon-Casey Clark, the medical director, and Buchra Wafta. Yes, good to see you, nurse practitioner. And I'm always made to feel comfortable here, and that's the big thing. You want to feel comfortable if you're going to places like this, right?
Yeah, absolutely. Yeah.
And today our subject is kind of cool. It's a common subject, and it can be very annoying: the restless leg syndrome. What's often overlooked, and can you talk more about that? What may cause it?
Yeah, so restless leg syndrome is typically manifested as an unpleasant feeling. It's uncomfortable, right. And there's typically an urge to move your legs because it feels uncomfortable. And these symptoms can manifest as aching, you can get throbbing, you can get creepy crawling sensations along your legs, and typically occurs in the late evening or at nighttime. So it's something that happens to about 7 to 10% of patients in the population. And one of the things that's typically overlooked in terms of the cause of restless leg syndrome is chronic venous insufficiency. And that's where we come in. We're a vein practice.
Right, okay, so that would help them. And Buchra, let's talk more about this venous insufficiency.
Absolutely.
What exactly is that? Put that into terms folks understand.
Actually, I happen to be a provider in a vein clinic, but I also had the issue of venous insufficiency. It's very family related, so genetics play a big role of how we get it. So one, genetics. Two, what we do for a living tends to make it worse or better. Our lifestyle, whether we have a sedentary or an active lifestyle, and pregnancies for females also augment the issue of venous insufficiency. To simplify it, the flow of the blood in the superficial venous system should be from the foot back up to the heart this way. When we have the presence of venous insufficiency, the blood tends to linger in areas that should not linger in, causing pooling, and it causes basically the valves in the venous system to become a little bit more incompetent, causing it to be a little bit more stagnant in those areas, leading to the symptoms that Dr. Casey mentioned as far as restlessness and cramping. And also what we see are chronic varicose veins, spider veins, which are annoying in presence and aesthetically not very aesthetically pleasing to the eye, and also causing the issues that we mentioned earlier.
And how is it treated? Is it
Yeah, it's treated here outpatient in the office, so it's a safe procedure. It's effective, it works. 95% of patients who go through it, actually, it's a procedure that's permanent. So it's eliminating those varicose veins, it's changing those spider veins, and it's actually relieving those symptoms in your legs, such as cramping, pain, swelling. You can see that very commonly, and of course, the way patients' legs look. And don't forget the restless leg syndrome as well.
Okay, some very good information. And what makes Ponte Vedra Vein Institute different when we're talking about treatment and trying to get back up to speed health-wise?
Yeah, we're very different from any practice here in Jacksonville because we have over 25 years of combined experience treating venous insufficiency and all aspects of vein disease. Plus, we're focused on you as a patient. We want to make sure that when you come in, we're taking care of you and making you feel and restoring your health particularly. We are also very passionate about vein disease, so therefore we're putting everything we have into it, from the diagnosis and the treatment, and we care about all of our patients.
I certainly can tell you both love what you do. So,
very
and of course, the comfort level, your smile, so that's very important, I'm sure, to the patient.
Absolutely.
And you've got a little call out to folks. You said you have a special going on?
Yeah.
So what we always offer complimentary screenings to anybody and everybody who walks in. One of our providers will take a look, and then based on what we find in the complimentary screening, then you'll be led into a diagnostic ultrasound that's done by our PA Crystal. She'll take a look at the deep system, superficial system. The diagnostic ultrasound is covered by insurance, and we take all kinds of coverage, Medicare, commercial insurance, and TRICARE. So we take care of all of our patients, and you'll know ahead of time how your insurance is going to cover all of these procedures, and you'll know exactly what you're going through. We make you as comfortable as possible. They're very well tolerated. There's no downtime. You really don't have to take time off of work. You can just get the procedures done and go back to work the same day. That's exactly how I did it. I had my procedure done by Dr. Casey and saw my patients immediately after. So very comfortable, and results are, I don't want to say almost immediately present or felt, but at least the heaviness is definitely taken off as soon as the procedures are done.
Very good. Well, thank you both so much. Of course, 2 convenient locations, not just the beach now, just off Gate Parkway is the second location. And of course, Ponte Vedra Vein Institute. And for more on this, just head to our website, and that's firstcoastliving.net.